What foods can prevent urinary tract infections? I'm Dr. Petronio Melo, a urologist, and today I want to talk to you if you've ever suffered from or are afraid of suffering from a recurrent urinary tract infection. Burning sensation when urinating, constant need to go to the bathroom, discomfort in the bladder, and other symptoms that really disrupt your routine. Many people come to my office asking if there is any food that can permanently eliminate this problem. The short answer is that food alone doesn't work miracles, but the good news is that what you choose to put on your plate every day can create an environment where bacteria have a much harder time settling in. Now, let's get to the kitchen. You've probably heard of cranberries, that little red fruit typical of cold countries, sold here in juice or capsules. Cranberries are rich in proanthocyanidins, compounds that hinder the adhesion of the bacteria Escherichia coli to the bladder wall. Without adhesion, the germ is carried away in the urine stream. To reap this benefit, choose juice without added sugar and drink 1 glass a day, or follow the recommended dose on the label if you choose the capsule form. If your palate isn't suited to cranberries, there are some very Brazilian options. Blueberries, jabuticaba, and even purple grapes contain similar polyphenol, which can reduce the ability of germs to adhere. They are also sources of fiber and antioxidants that balance the intestinal flora, which also helps to reduce the number of harmful germs in the perineal region. Including a portion of red fruits in your breakfast or as an afternoon snack is already an important step in prevention. Another valuable group is that of fruits rich in vitamin C, acerola, guava, kiwi, and orange make urine slightly more acidic and, at the same time, strengthen the immune system. 2 servings a day are enough to reach the daily recommendation and strengthen this natural barrier against infections. Now let's talk about probiotics. They are found in natural yogurt, kefir, and some fermented cheeses. By colonizing the intestine with good bacteria, these foods reduce the presence of harmful microorganisms that could migrate to the urethra. Studies show that women who consume probiotics daily have up to 40% fewer episodes of cystitis. To enhance the effect, combine probiotics with prebiotics, the fibers that feed these beneficial microorganisms. You can find prebiotics in green bananas, oats, and beans. The combination improves intestinal transit and reduces contamination of the intimate area. Anti-inflammatory spices such as turmeric and ginger also play an interesting role. They modulate the body's inflammatory processes and make the organism more prepared to react when a stubborn germ manages to escape the physical barriers. A pinch of turmeric in rice or meat sauce and a few slices of ginger in the bottle of water you drink during the day can make a difference. Prevention, however, is not just about adding what is good for you, it is also about avoiding what favors bacteria. Excess refined sugar, soft drinks, and ultra-processed foods alter the balance of intestinal flora, increase inflammation, and weaken the immune response. If the goal is to keep your bladder healthy, swap soda for sparkling water with lemon and save sweets for special occasions. Excess saturated fats, found in fried foods and fast food, follow the same path of disrupting the immune system. You may be considering concentrated cranberry supplements or probiotic capsules. These can be helpful, especially when you're on a busy schedule or traveling long distances. However, whenever possible, try to prioritize the natural form because the food provides a set of nutrients that work together. If a supplement is the best option for you, use it under medical or nutritional guidance. As a urologist, I must emphasize that diet helps reduce recurrence, but it is not a substitute for proper investigation. If you experience pain when urinating, frequent urge to urinate, fever, or notice blood in your urine, seek medical attention immediately. An infection that progresses to the kidneys is more serious and may require hospitalization for intravenous antibiotics. Therefore, make good choices in your diet, drink enough water, and keep your tests up to date. If you want to closely assess your urinary health, find out if your bladder is emptying completely, or find out if there is another factor that is facilitating infections, schedule an appointment with me. I see patients in person in Sao Paulo, Vila Mariana, and I offer online consultations for anywhere in Brazil or the world. It will be a pleasure to provide you with personalized care. If this content was useful, share it with anyone who needs it, subscribe to the channel, and turn on notifications so you don't miss the next videos. Taking care of your urinary health is a simple investment that brings a lot of comfort and prevents sleepless nights. Thank you very much for your company. Take good care of yourself, and see you soon.